As spring travel, family gatherings, and outdoor activities begin to ramp up, health experts say now is a critical time for Americans to catch up on routine and overdue vaccines. This is an ideal time to check in with your pharmacist about vaccinations. With more on how to protect your health heading into the season, we welcome Dr. Nadia Ahmad. Thanks for joining us.
Thanks for having me.
So what are some of the latest updates and recommendations for the flu, COVID vaccine, and RSV vaccines?
So the key message I tell my patients is to stay up to date on all recommended vaccine, and it continues to be the most effective way to protect your health. For flu vaccine, if anyone has missed their flu shots in fall, it is still okay to get in late spring, especially if the flu is lingering around, and RSV vaccine is recommended for everyone 75 year and older, and select patients with certain health conditions from 50 to 74. And same is true for COVID-19 updated vaccine. If immunity wanes over time, it's recommended to get the vaccine, and your pharmacist can help identify which vaccine you need and you're eligible. So have a conversation and get that layer of protection.
You kind of touched on this, but there's so many vaccines out there. So how does someone really know what vaccines they actually need?
So that's where I hear a lot. My patients walk in and they ask me the same question. I'm not sure which vaccine we need and which one I'm eligible. So that's where role of pharmacist is even more important and crucial. We can help identify based on your age, health condition, risk factors, lifestyle, and even timing of the year, or if you have travel plans, which vaccine you're eligible. So the key is to talk to your pharmacists, which are highly accessible in your community, and get that plan in place.
And beyond just the respiratory viruses, what other vaccines do pharmacists provide?
So we provide all vaccines recommended by CDC, from hepatitis A, B, shingles, pneumonia, RSV, to specific vaccines like meningococcal and measles, mumps, MMR vaccine, and even rabies vaccine. So we have everything in place to keep our communities healthy and protected.
And what populations are considered high risk, and should adults have immunizations really a priority to them?
So any patient, especially with chronic health condition like heart disease, asthma, COPD, lung disease, or patients who are immunocompromised, or cancer patients, and also age is also a factor, we can help identify which vaccine you're eligible. The goal here is to get that protection and avoid vaccine preventable disease and its risk and complications and hospitalization. So your pharmacist can help develop that personalized vaccine plan. So have that conversation with us.
And with the warmer weather, a lot of people are going on vacations. So why is it important to discuss travel plans with the pharmacist in regards to vaccinations?
So it is very important to talk to your pharmacist, and I have these conversations daily at my community setting with my patients when they share their travel plans, and I ask them if they are up to date on their routine and travel specific vaccines. And most of us, without us knowing, are behind on one or two vaccines. So we can help determine which vaccine you need. The goal is to get that protection, because travel and those gatherings can expose you certain illnesses which are not common, and you want to avoid any risk or disrupt or derail your summer plans or trips. So have this conversation and we can tailor your vaccine plan based on your needs and travel plans.
And besides talking to a pharmacist, where can people go to learn more?
So you can always check American Pharmacist Association website, but my recommendation is to talk to your local pharmacist. We are here, you partner in your health journey. We can guide you through these life-saving vaccines, because your health should be your number one priority. And it is I recommend that to invest in this spring and get those recommended vaccines and stay up to date.
This was really good information. Dr. Ahmad, thank you so much for stopping by Great Day Live this morning.
Thank you. Thanks for having me.